Yet to meet the dentist that has 100% case acceptance. I've yet to meet that. I've met some very, very, very gifted. I want to share 4 very specific tips that any of our listeners at any stage of their career can use to improve case acceptance. And there's always room for improvement. There's always room for. I've yet to meet the dentist that has 100% case acceptance. I've yet to meet that. I've met some very, very, very gifted doctors when it comes to case acceptance, but that mythical 100% has not happened. It doesn't happen. So we can always get better. All right, I've got 4 very specific tips. Let me start with number 1. Use digital photography for patient education. Take photos. And I'm going to make it very specific for you. Follow Dr. Frank Spear. This comes directly from Frank. Take 6 photos for patient education. And those 6 photos, and these are digital photos. They aren't intraoral photos. I want to emphasize that. Intraoral cameras are great, but I'm talking about digital photos because it's a medium that everybody understands. Everybody's looked at photos. Not everyone's looked at intraoral photos, but everyone's looked at photos. It's a medium they understand. So here are the 6 photos that I want to encourage you to take on all new patients. Number 1, a head and shoulders shot, natural smile. Just have the patient smile naturally. Number 2, a close-up retracted view. Have the patient hold the retractors himself and make it a close-up. In the viewfinder, you want middle of nose to middle of chin, middle of cheeks. It's a close-up. Have the patient say "ee." Have them open so that there's about a 1/2 to 3/4 of an inch between the occlusal surfaces of their upper and lower arch. Number 3 and 4, we borrowed from our friends, the orthodontists. We take an upper occlusal view and a lower occlusal view. And we're using the hourglass-shaped mouth mirrors. You're not actually taking a picture of the teeth. You're taking a picture of the reflection of the teeth in the mirror. Those aren't easy to take because the mirror can fog, the tongue can get in the way, the cheek can get in the way. But with a little bit of practice, you can all learn to master those photos. And if you have a great colleague that's an orthodontist, maybe he or she could do a little photo workshop for you and your team because the orthodontists have this wired. Pictures number 5 and 6 are left buccal corridor and right buccal corridor. And I recommend that your dental assistant or new patient coordinator takes those photos. Now, Naren, why do you think I'd recommend that your dental assistant or the new patient coordinator take those photos?
Because it takes time, so if they can do it, it's going to save some time for the doctor.
Yeah, because she can.
Yeah.
She can. All the other reason is that as approachable as you may be, doctor, and I hope you are approachable, patients will sometimes be more comfortable talking to your team members.